Hello and welcome. This is Dr. Peter Nixick, resident at the University of Wisconsin Division of Plastic and Reconstructive Surgery. We at the Pore Lab would like to thank you for watching our supplemental video on the end-to-end microanastomosis technique running all the way from the top. This video will cover lesson 6C of the microsurgical training manual, running all the way from the top method. This is an alternative method of end-to-end anastomosis that is useful for when the recipient vessel is not long enough for a double opposing Acklin clamp. In contrast to other methods, the first stitch is placed in the midline of the front wall of the vessel. We recommend that the assistant offloads tension on the recipient vessel as the surgeon ties a surgeon's knot to hold the vessels in place. It is important to use differential tension to align the edges of the vessel. Using the tail of the first stitch as a handle, the second stitch is placed towards the assistant. It is helpful for the assistant to hold the recipient vessel towards his or herself to provide counter tension for placement of the second stitch. In contrast to the back wall first method, this method allows the surgeon to perform the entire anastomosis in his or her forehand. However, it is very important to place the sutures evenly so as to not create dog ears and subsequent leaks in the anastomosis. This same process is repeated until the anastomosis is completed to the midline of the back wall. Once the anastomosis is completed to the midline of the back wall, the process is reversed and the assistant holds the tail of the first suture while the surgeon maintains counter tension on the recipient vessel. This process is then repeated with subsequent stitches until the anastomosis is complete. When you estimate that you are down to the final 2 stitches of the anastomosis, you can run these stitches to decrease your risk of backwalling. When running, it is helpful to leave the needle in place within the vessel to act as an anchor point and prevent pull-through when tying the previous suture. When the anastomosis is complete, the surgeon and assistant trim all suture tails. At the completion of the anastomosis in the blue blood chicken thigh model, the methylene blue is then ran through the femoral artery to examine for leaks and patency. This concludes lesson 6C of the microsurgical training manual, running all the way from the top method.